5 medical tests you should think twice about after the age of 70, because for many seniors, they may do more harm than good. There's a side of healthcare that most seniors are never told. Every year, millions of older adults go for routine screenings thinking they're protecting themselves, but what if some of these tests are quietly putting your health at risk instead? Imagine this: a simple test your doctor recommends could be the very step that leads you towards surgery, a stroke, or even cancer. Sounds unbelievable, right? But recent research shows that nearly 1 in 3 tests done on seniors lead to unnecessary treatments, false alarms, or dangerous side effects. And even more shocking, almost 99% of people over 70 have no idea they're being over-tested. And wait till you hear this: the test that ranks number 1 on this list is responsible for nearly 5% of all cancer cases in the United States. That's almost the same number of cancer cases caused by drinking alcohol every single day. You won't see this on hospital posters, and most clinics will never bring it up. But the science is clear, and today, we're going to uncover it together. In this video, I'll share the 5 health checkups you should avoid after 70, why they might be hurting you instead of helping, and the truth every senior deserves to know, especially number 2. Before we begin, I would love to know, where are you watching from? How old are you, and have you ever regretted doing a medical test or procedure? Tell us in the comments. I read every single one and reply with personalized advice. And don't forget to like this video and subscribe to Senior Care so you never miss important health tips. Let's start with number 5. Number 5: bone density scan. It sounds harmless, right? Just lie down, get scanned, and go home. But for most people over 70, especially if you've never had a serious fall or broken a bone, this test can cause more fear and unnecessary treatment than real help. Here's the hidden truth: after age 70, almost everyone shows lower bone density. It's a natural part of aging, just like gray hair or wrinkles. But when the scan shows even a small drop, many doctors immediately prescribe strong bone medications like bisphosphonates. These medicines can cause painful side effects, jawbone damage, osteonecrosis, severe acid reflux or stomach irritation, esophagus inflammation, and even rare fractures in unusual places like the thigh bone. A study published in the Journal of the American Geriatric Society followed over 1,200 women above 70. Bone medicines reduced fracture risk by only 0.3% over 5 years in women with mild bone loss, osteopenia. But the side effects were far more common and serious. So what's a smarter choice instead of rushing for a scan? Gentle weight-bearing exercises, walking, stair climbing, light resistance bands. Calcium plus vitamin D from foods like yogurt, sardines, leafy greens, fortified milk. Balance exercises to prevent falls, tai chi, heel-to-toe walking. If needed, check vitamin D levels, not just bone scans. Real story. Eleanor Mitchell, a 74-year-old retired school teacher from Ohio, USA, stayed active with morning walks and gardening. She'd never had a fall. During a routine checkup, her doctor suggested a DEXA bone scan, just to be safe. The scan showed mild bone loss, which is normal at her age. Still, she was given strong bone medication. Within a few months, Eleanor developed stomach pain, acid reflux, and jaw discomfort. She stopped walking because she felt weak and tired. A new doctor later told her the truth: she didn't need the medicine at all. Instead, he advised daily walking and light strength exercises. Calcium and vitamin D from food and sunlight. Balance exercises to prevent falls. Eleanor stopped the medication. A year later, she felt stronger, had no fractures, and said, "I wish someone told me earlier, not every scan needs a strong pill." If you're over 70, active, and have never broken a bone, a DEXA scan may cause more worry than benefit. Always ask your doctor if it's truly needed. Number 2: brain MRI. Memory problems can be scary: forgetting names, misplacing things, losing track of conversations. That's why many seniors are rushed into getting a brain MRI, thinking it will prevent dementia or catch Alzheimer's early. But here's the truth most people don't hear: why routine brain MRIs may do more harm than good after 70. Most age-related memory changes are normal, caused by slower brain processing, not disease. MRIs often show harmless things like white matter changes or mild brain shrinkage. These are common in almost every person over 70, but once doctors see them, they may label you as having a disease. This leads to unnecessary medications, anxiety, more scans, and sometimes even dangerous lumbar punctures or biopsies. And here's the surprising part, there's still no cure for Alzheimer's or most forms of dementia. The MRI doesn't stop memory loss, it often just increases fear. What the research says, a study in JAMA Neurology showed that over 35% of brain MRI findings in seniors are incidental, not dangerous, but they lead to follow-up tests or treatments anyway. Another study from Harvard found that routine brain MRIs rarely change treatment for mild memory problems. When a brain MRI actually makes sense, only if memory loss comes with sudden personality changes, seizures or fainting, slurred speech or one-sided weakness, possible stroke or tumor, rapid decline over weeks or months. Otherwise, lifestyle changes are far more powerful. Better approach for memory health, daily 30-minute walking, boosts blood flow to the brain. Omega-3 rich foods, walnuts, salmon, chia seeds. Social conversations and puzzles, keep neurons active. Good sleep and hydration, your brain cleans itself during sleep. Real story. Robert Hayes, 72, from Texas has spent most of his life running a small car garage, fixing engines, restoring old cars, and teaching younger mechanics the joy of good craftsmanship. Last year, he started forgetting small things, where he kept his keys, the names of a few customers, or which tools he'd used. His doctor immediately sent him for a brain MRI, suggesting it might be early dementia. The scan showed normal age-related changes, nothing dangerous. But the test left Robert anxious for weeks, worrying about something he didn't actually have. His new neurologist later explained that mild memory lapses at his age can come from stress, poor sleep, dehydration, or lack of mental stimulation, not necessarily dementia. Robert made simple changes, staying hydrated, sleeping on time, and keeping his mind active by working part-time in his garage. Within months, his focus improved, without the fear that the MRI created. His words, "I wish someone had told me that not every scan needs treatment." A brain MRI sounds like the smart thing to do, but for normal, age-related forgetfulness, it can create more stress than solutions. Use it only when symptoms are serious or unusual, not just for everyday memory lapses. Number 3. Colonoscopy after age 70. For decades, colonoscopies were considered the gold standard for preventing colon cancer. And yes, between ages 45 and 70, they save lives. But after 70, especially after 75, the risks often become greater than the benefits, and very few seniors are told that. Why colonoscopies can be dangerous after 70 to 75, the colon becomes more fragile with age, making it easier to tear or perforate during the procedure. Sedation used during colonoscopy can lead to irregular heartbeat, low blood pressure, confusion, or even stroke in older adults. The bowel prep, drinking strong laxatives to clean the colon, can cause dehydration, kidney issues, and electrolyte imbalances. What research says, a Harvard study found that complication rates from colonoscopy increase by 214% in adults over 75. Another study in JAMA Internal Medicine reported that for people over 70 with no symptoms and a history of a clear colonoscopy, the chance of finding cancer is just 0.2%. Some doctors still recommend it, not because you need it, but because it's part of routine care. When is it still useful? You should still consider a colonoscopy if you have blood in your stool. Sudden weight loss with no explanation. Long-term stomach pain or severe constipation. You've had colon polyps or colon cancer in the past. Safer alternatives after 70, FIT stool test, fecal immunochemical test, simple, no sedation, no risk. Cologuard test, stool DNA test for cancer risk. Healthy gut habits, fiber-rich diet, hydration, walking. Real story. John, 78, had no stomach issues, no previous cancer, and his last colonoscopy at 65 was completely normal. But during a yearly checkup, his doctor said, "Let's do another one to be safe." During the procedure, a small tear happened in his colon. He developed internal bleeding and needed emergency surgery. He spent 9 days in the hospital, all for a procedure he didn't even need. Later, another doctor told him, "You didn't need this test. At your age, the risks were higher than the benefits. If you're over 70 and have no symptoms or previous colon issues, a colonoscopy may expose you to more danger than protection." Always ask, will this test truly change anything for me? Number 2. Annual PSA test for prostate cancer. You might think a simple blood test couldn't do any harm. But after age 70, routine PSA tests, prostate-specific antigen tests, can create more problems than they solve. Why it's risky? PSA levels naturally increase with age, even without cancer. But when doctors see a high PSA number, they often rush patients into more tests, biopsies, MRIs, even surgery. Prostate biopsies can lead to bleeding, infection, urinary problems, and long-term sexual dysfunction. Worst part: most prostate cancers in men over 70 are slow-growing and never cause harm or death, but the treatments can lower quality of life forever. What science shows: according to the U.S. Preventive Services Task Force, PSA screening is not recommended for men over 70. A Harvard study found that for every one life saved, 48 men go through unnecessary surgery, radiation, or lifelong side effects. Many seniors die with prostate cancer, not because of it. When should PSA be done? Only if you have symptoms like painful urination, blood in urine, or pelvic pain. You have a strong family history of aggressive prostate cancer. You and your doctor fully discuss risks and agree it will change your treatment. Safer approach: regular checkups, urine tests, and symptom monitoring. Anti-inflammatory foods: tomatoes, flaxseed, green tea. Pelvic floor exercises to strengthen bladder control. Real story of Richard, 74, had no symptoms, but his routine PSA test came back slightly high. Doctors pushed for a biopsy. He agreed. After the biopsy, he developed an infection, spent 5 days in the hospital, and was put on antibiotics. Test results: no cancer, just age-related enlargement. He later said, "The test didn't save me. It scared me." If you're over 70 and symptom-free, PSA testing may lead you toward treatment for a cancer that would never harm you, but the side effects might. Number 1. CT scan for heart disease. This one is the most surprising, and the most harmful when misused. Heart CT scans are often advertised as life-saving early detection tests. But after age 70, this scan can do more damage than good. Why it's dangerous? It uses high levels of radiation directly on your chest, near your heart and lungs. Over time, radiation can damage DNA and increase cancer risk. It often shows calcium buildup in arteries, which is normal in many healthy seniors. But once that calcium is seen, doctors may push angiograms, stents, blood thinners, or cholesterol drugs you don't even need. Each extra procedure increases risk of stroke, bleeding, kidney damage, or heart attack caused by the test itself. What science says: studies from the Journal of the American College of Cardiology show that after age 70, calcium scores do not accurately predict heart attacks. 5% of all cancers in the U.S. are linked to radiation from CT scans. That's similar to the cancer risk from daily alcohol consumption. Harvard researchers found that for many seniors, lifestyle changes work better than heart scans or stents. When is a heart CT scan useful? Only if you have chest pain or suspected heart blockage. Your doctor needs it to plan surgery or treatment. You're under 70 with high risk, diabetes, high BP, smoking history. Safer heart protection instead: 30-minute daily walk or slow cycle. Mediterranean-style diet: olive oil, fish, nuts, vegetables. Deep breathing or yoga lowers blood pressure naturally. Keep cholesterol and blood sugar checked through simple blood tests, not radiation. Real story of Helen, 71, felt fine but took a preventive heart scan because her friend did it. Her report showed calcium buildup. Doctors recommended an angiogram. During the procedure, she developed an irregular heartbeat and had to stay in the hospital. Later, her cardiologist told her the truth: this didn't need treatment, it was normal aging of the arteries. A heart CT scan can sound like protection, but for healthy seniors over 70, it can be the first step into unnecessary surgeries, fear, and radiation damage. So there you have it, 5 medical checkups that can quietly harm more than help after 70. Modern medicine has given us amazing tools, but sometimes the best care is knowing when to say no. Remember, it's not about avoiding doctors. It's about asking the right questions. Will this test actually change my treatment? What are the risks if I skip? Is there a safer alternative? If your doctor can't answer clearly, that's your cue to pause. Because real prevention doesn't come from machines, it comes from movement, nutrition, rest, and peace of mind. Your health is not a number on a screen, it's how you feel when you wake up each morning. Now we'd love to hear from you. Have you or someone you know ever had a test or scan that caused more stress than good? Share your story in the comments below. Your experience could help someone else make a smarter choice. If you found this video helpful, please hit the like button, subscribe, and turn on the bell so you never miss new videos on senior care. Thank you for watching, and we'll see you in the next one. Stay active, stay wise, and stay kind to yourself. Green Heart.